Welcome to the June 3rd Sacramento County Public Health Media Briefing. And we are, Dr. K is not going to be able to join us today, so I'm going to go ahead and throw it over to Jamie White to provide us with the beginning of our update.
Jana. Sacramento County has had 106,570 confirmed COVID-19 cases to date, with 1,715 COVID-19 deaths. 1,296,958 vaccine doses have been administered, and there are now 590,156 fully vaccinated individuals in the county. The county has had 98 vaccine breakthrough cases. We have been notified of 503 variant cases, including UK, West Coast, South Africa, India, Japan, Brazil, and New York variants now circulating locally. More details can be found on our COVID-19 epidemiology dashboards. The state assigned Sacramento County to the orange tier in its blueprint for a safer economy as of Tuesday, June 1st, 2021, based on meeting the threshold criteria for 2 consecutive weeks of a case rate under 6 per 100,000 population and test positivity under 5% using a 7-day average and 7-day lag time for both metrics. The state calculated metrics used for Sacramento's tier reassignment showed Sacramento County at a case rate of 5.5 and test positivity of 2.4 for the week of May 9th through 15th, and a case rate of 4.4 and test positivity of 2.1 for the week of May 16th through 22nd, 2021. While moving into the orange tier just 2 weeks before the state opens on June 15th, may not have a huge economic impact for local businesses that are able to loosen restrictions now. It is encouraging that we are continuing to move in the right direction for the health of our residents and communities. June 15th will lift most capacity and distancing restrictions for businesses and activities. The state will have some testing and or vaccination requirements for certain large-scale indoor events and require an adherence to any updated COVID CDH masking guidelines. Dr. Kasiri's current local health officer order is set to expire on June 15th in accordance with the state lifting of the blueprint, including the local masking mandate. She currently has no plans to issue additional countywide health officer orders. Residents of the county will still be subject to any state or federal restrictions. The California Occupational Safety and Health Administration, or Cal-OSHA, published its revised proposed COVID-19 emergency temporary standards, or ETS, last Friday. Those are supposed to be voted on this week. While not finalized, the proposed rules and regulations for the workplace, if passed, would be much stricter than the state or federal guidelines, including employee masking beyond June 15th. Media questions regarding the ETS should be directed to Cal-OSHA, and employers should be consulting with their own risk management or legal departments to ensure compliance with the laws. Our team is continuing to go through vaccination records in the California Immunization Registry to find individuals that have missed their 2nd dose of vaccine, focusing on those age 65 plus. They've developed and modified a phone script after testing it. We've requested assistance to follow up with these individuals from providers that administered the initial dose. We urge people who have missed their 2nd dose to get one, and for providers to administer them, even if it's outside the recommended vaccine interval. We'd like to once again extend an invite to any businesses or organizations interested in hosting a vaccine event and or to provide vaccine incentives to reach out to us. You can reach us at covid19@saccounty.net. And with that, speaking of incentives and business partnerships, I will pass it over to Rachel.
Hey, good morning. I'll start with the incentives then. Just an update. We've had 2 of 3 planned events with the Sac Republic in conjunction with Equivax, where vaccines were provided at Sac Republic games, and the persons who registered for an appointment were given a free ticket. And we were out for both of those events. Super fun, super energetic, really happy to be able to support for that. There's one more game this Saturday, so we want to make sure people don't miss this opportunity. And the Sac Republic has sweetened the deal by offering 2 tickets for each person who registers for a vaccine appointment. So a person can make an appointment and then bring a friend to the game. So we hope people will go out and use this opportunity to get vaccinated. And of course, it gets them into the second dose game, which is going to be on June 26th. So you're really getting 2 games for going in and getting a vaccine. So grateful for that partnership and hope people will take advantage of that. And then just to mention, for the second week in a row, the state did not issue a pre-allocation to any counties, including Sacramento. So again, focusing on redistribution of doses that are already in the county amongst provider offices and also here at Public Health. And we certainly had the option to order vaccine if we needed to. We chose not to. We feel like we still have an ample supply of all 3 vaccines here in Sacramento. The state has also developed a vaccine marketplace where providers can post their excess or short dated doses, and other providers can essentially go and shop there if they're looking for a vaccine. So the goal really being not to waste any doses and making sure that we're using short dated vaccine or vaccine that's already here prior to bringing more vaccine into the county. And then next week, we're going to move back to what we did a few months ago, which is really where providers can order as needed vaccine. Again, we'll be approving those orders, and we will be encouraging people to first check the marketplace and make sure that they don't order vaccine if there's someone else who has excess supply that they could take from. And I'm going to pass it over to Mike.
Thanks, Rachel. I want to share with you all, the state also announced their Vax for the Win campaign, which is a state incentive vaccination program. They're giving out $116.5 million, $16.5 million for all vaccinated folks. That includes prizes of 10 winners for $1.5 million. And then every raffle for Fridays for 30 winners of the amount of $30,000. And for the next 2 million individuals who get vaccinated, beginning May 27th, they are going to get $50 incentive cards where they could utilize, go grocery shopping, buy various items, including sausages and whatnot. So that's my update.
Thank you, Mike. Okay, so we will move into the question and answer period. If you are on the Zoom platform, you can either use the raise your hand feature or put comment in the chat, and I will call on you. Do we have any questions? Michael.
Hi,
Michael, we cannot hear you.
I'm wondering just now, ages 12 through 15 were authorized to get the vaccine. Are there any, are we seeing strong demand in that group, or are there any plans to have any of these incentive type events that are specifically geared toward adolescents? That's my main question.
I'm not sure if we heard the whole question because you were coming in and out, but yeah, we're certainly, we're working with schools and working with pediatric providers to reach that 12 to 15-year-old population. And I think seeing pretty good uptake. We know that we'll have to sweeten that as well. And I think we have some upcoming partnerships over the summer that we'll be able to announce later with Sac Republic and others to reach out to events to really draw in that population. And we'll continue to work with schools and with providers as we get into the back to school season as well. So it's going to be an ongoing process, and we'll just keep reaching out and trying to reach that population. Was there a second part of I'm not sure if we missed another part of that question.
No, you got it. Thank you.
Okay, I have Izzy.
Hi. Is there an update on the Cosumnes River College Clinic?
So we're still in the contracting process. We have hit a little bit of a hiccup in that we have authority to execute contracts currently through June 30th. And so by the time we get one executed, we'll have to redo a contract. And so we're just waiting for a few additional items from our partners to be able to process those contracts. But yes, we're still moving forward with it. And that'll likely be in the cafeteria at Cosumnes River College.
And I know you said that still in the contract negotiations phase and everything, but is there at least kind of an estimate of when it might open, or no?
So I think worst case scenario would be July 1st. If we're not able to execute it with our existing authorities, we have to wait. We're going to the court for authority to execute contracts from July 1st through December 31st on June 15th.
Awesome. Thank you.
Okay, do we have any additional questions? I don't see any hands raised. There's no one in the chat. If not, as a reminder, I will send out this full recording within an hour, as well as a couple links to some of the things that we've discussed today. And we will pick back up with a media briefing next Thursday. So if there are no more questions, I will go ahead and end. Thanks for joining us for the Sacramento County Public Health Media Briefing.